Hi guys, once again. Hope everyone is doing good. And this day on our side it's so cold. Just asking, have you ever wondered why sometimes when a person is when it's sick, it becomes delusional or sometimes confused? Yes, today we have the let's see. Yes, we are good right now. I can see Mark Brown in the house. Welcome, Mark Brown. I can see Carole West. Oh, my supporter, Carole West. Hi, if you're doing good, everything is good. I'm just asking some people here, have they ever wondered why when a person is sick, this person at times becomes delusional or become confused or what? Today we will have the answer. If you have been dealing with a sick person and this sick person at times become confused, we will know why. At our first video, we talked about the past of the brain. The brain is a very complicated but large thing. You will know why some children take long to walk, or sometimes people have problems with gait. Gait is normal walking. So if you have a relative or a family member who got a disease and became disabled due to the disease, maybe today you will know why this family member or someone became like this. Now, in the brain, we talked about something called the basal ganglia. Yes, the basal ganglia. It is between the inner brain, inside the brain, and it coordinates movement. The basal ganglia coordinates movement, and sometimes it with the frontal brain, with the front part of your brain, they work together to coordinate you to walk well, because your brain helps you to coordinate your movement, of course. Now, let's see how the coordination comes in the basal ganglia. In the basal ganglia, there are some there is something like a tissue inside the brain, like a tissue. They are a group of deep brain structure involved in motor control, in movement, as well as roles in cognition, emotions, and habits formation. Emotions. So if you lack emotions, you will know why at times you don't have the emotions, and at times you are not responding better to some issues emotionally. And habits, your habits, how you learn habits. The deep basal ganglia have said they are a group of brain structure involved in this, in control, cognition, habit formation. They help regulate and define voluntary movement. Voluntary. When you want to pick a pen, when you want to pick your phone, when you tell your brain, now I want to take that pen from there to here, that thing called the basal ganglia. I don't know where my pictures are, but we'll find one. The basal ganglia is the one which tells you, now pick the pen, now walk around, and then you start walking without eat. Yes, I found the previous pictures. Yes, hypothalamus, midbrain. Yes, I've seen my pictures here. Now, this one is it, the limbic system. Remembering the limbic system, the basal ganglia is around inside your brain. Now, it's a tissue. Look very well. This one, this one. Look at it very well. Hmm? Group of deep brain structure primarily involved in motor control. Yes, motor control is movement due to your muscles. Control is movement due to your muscles. So, inside the brain, that basal ganglia, that thing that we have seen here, that thing that we have seen here, it has several layers. The main components, the first is called caudate nucleus. Caudate nucleus, we will see what they do. The second is called putamen. And as we go on and you have a question, please feel free to ask any question. I'll answer on my live. It has putamen and then it has globus pallidum. Now, those are the three layers. Today is a quick live. Someone asked me a question because this person has a disabled person who was sick due to malaria and then the person became disabled. Now, we go on. There is another one called subthalamic nucleus and substantia nigra. The functions of these layers is to initiate and inhibit movement. When you think of initiating and stopping, regulate of muscle tone, learning skills. When I teach you to do something like hit it like this, the basal ganglia is the one which does it. Reward and reinforcement learning. Yes, reward and reinforcement. In the first video, we talked about dopamine, you remember? And then we have cognitive and emotion processing. Yes, when you process your emotion, when you are hurt, it's the basal ganglia which helps you. The pathway, there are two types of pathway. Direct pathway, which helps you to move, and in the direct pathway, which inhibits the movement. You see, the basal ganglia can be affected so much by some things that may cause a problem in your brain, like let's say encephalopathy. Encephalopathy is a general term that means dysfunction of the brain. Yes, dysfunction, NSAID. It refers to any diffuse brain disease that alters its structure, any disease that may make your brain structure to be altered, that may alter your mental status, confusion, memory. When you lack memory, when you sometimes you don't remember, when you don't remember some things, and sometimes you may find a good person changes drastically. You start having a very funny personality, or unconscious. You become unconscious. We have several types of causes. Let's go to causes that may make your brain to not to function well. Yes, yes. Let's see what we do. Because some people become sick, and these people, when they are sick, they are saying, "I'm just having a flu," but they start becoming delusional, or they start changing mood, or they start having um, what can I say? They start having difficulties in walking. Now, let's know today what you are not supposed to ignore, so that you cannot be so that you cannot you cannot become paralyzed, or you cannot lose movement. Yes, when we talk about liver diseases, I will not go deep down to this video on liver diseases, but I will arrange a day where we will talk about the liver. But today, I want to talk how liver disease can make you disabled, can make you not to function normally as a human being. Now, in the liver, we have cells, liver cells. These liver cells are called hepatocytes. When they die, because when you take food, when you take drugs, when you have a disease, it can, because the blood circulates all over the body and it goes to the liver and then it comes out back. When it goes and when there is a way a liver metabolizes, destroys something so that it can easily be taken away from your body, and what you've taken is so heavy to the liver that it's destroying the liver cells. Now the liver produces something called bilirubin. Mhm. This thing called bilirubin can go mostly in children. When you see a child with yellow eyes, and then you see the palms are yellow, that is called bilirubin. It goes to the it goes to the blood, because it is not broken down. The process called conjugation, it cannot be eliminated from your body through urination or feces. It circulates in your body because it cannot be absorbed in water. Yes, because it's only things that can be water absorbable or can be removed from your body through urination or food. So what happens? The bilirubin it crosses your brain structure and goes down to the that structure called basal ganglia. So it causes some brain the cells to die, which is called encephalopathy. That is one thing. And then there is something, the pile up of ammonia. The pile up of ammonia. Ammonia can pile up due to liver failure. You see, ammonia can pile up due to liver failure. And ammonia is a toxin. So when it goes and piles above the normal range, because now your liver cells are producing more ammonia, it can go up to the brain. What happened next? It's a toxin. Yes, symptoms of pile up ammonia in the basal ganglia. What is it? Confusion, sleep disturbance, liver flap. We call it a coma in the liver. You see, those are things some people see, and then they don't know what happened. They just say he's very sick, but they don't know there are some things that are happening that are making this person disabled. Like a baby who has elevated bilirubin, this baby can be disabled for a very long time, and it is not good. We don't need to ignore, we need to rush this baby to a hospital. And then there is a loss of oxygen, which is called hypoxic ischemia encephalopathy. That is in the brain. You want to get warm, so you are sleeping in a room. Some other nations, they like using charcoal or burning firewood. Hmm? You burn in the house, then you close the windows and the doors. What comes out? CO2, because the fire is using oxygen. So lack of oxygen leads to brain death. That is another one. This one is a very direct thing that can make you get a coma. Memory loss. Yes, because the basal ganglia plus the frontal lobes of the brain, they help us when it comes to cognitive functions. So if you don't have any cognitive function, you start having memory losses. Yes, neurological deficits. You start having difficulties in coordination. Then there is metabolic encephalopathy, metabolic electrolyte imbalance, uremia, hypoglycemia, vitamin B deficiency. Yes, people that are diabetic, sugars going high, imbalance like uremia. Uremia, when you come to the kidney, the kidney is not able to filter your blood so well. You get Yes, Beauty, I can see you. Welcome on the chat. Yes, yes, yes. We are just talking about random things that can make someone be um, disabled or a person not to work well because of the brain death. Now, you see, you get something like metabolic encephalopathy. When someone is diabetic, be very careful with the anti-diabetics drugs. You see, hi Janet Harris, welcome to the chat. We are talking about disability due to problems that may cause the brain death. And we have talked about the basal ganglia. We are continuing. Now, you see, if you have a relative or a family member who is diabetic, and then this person takes a lot of drugs of anti-sugars. We call them anti-hypoglycemia. Those drugs that make you not your sugars to go up. Your sugar level may go down so much, and then you will become hypoglycemic. We call it metabolic. So you need to control and make sure they have a gadget where they are seeing their sugar levels. Kidney failure. Kidney failures are very common nowadays. We get uricemia. Uricemia, high uric levels. You'll become confused because high uric levels makes the brain and the basal ganglia not to coordinate. You will not even walk. Let's be close to doctors when you have chronic issues. If you have a question, please put it out. We are just starting and continuing. Toxic encephalopathy. Those people who like drinking a lot. Our next topic tomorrow is about alcohol and substance. I think tomorrow at that topic we will come very clear about how alcohol and substances ruins health and leads a person to depression. So here we can see it is alcohol, heavy metals or toxins that can lead to your brain death. You see that mental health and brain death, they are family. Now, infectious encephalopathy. Encephalopathy, inflammation of the brain meninges, basal ganglia leads to meningitis. Meninges of the brain inflammate. Why? Because there is a bacteria that has crossed and has gone to the brain. So it is forming colonies, and you are having what? You are having confusion, you are having high heartbeats, you are having high temperatures. Now, meningitis is not a good thing. And in meningitis, we have two types of meningitis. We have bacterial meningitis and fungal meningitis, even viral meningitis. Bacterial meningitis is treated in a period of at least 2 weeks to 3 weeks with antibiotics, and they should be intravenous, not oral antibiotics, intravenous. So when you get a person is having stiff neck, this person cannot turn the head like this or like this. No, this person is having meningitis because the brain is having inflammation. Rush this person to hospital. How do we differentiate between viral meningitis, bacterial meningitis, and fungal meningitis? Fungal meningitis is mostly associated to people that are these people that are immunosuppressants, people that are on ARVs, people that have HIV, immunosuppressants, people that have some cancers. Yes, people that have some cancers like leukemias. Those are people that their immunity are down. They are prone to fungal meningitis. Fungal. You get it? And there are people here that have bacterial meningitis. You see, be very careful when you're having chronic infection, mostly that are involving your nose, mouth, and throat. Mostly here at the eyes, nose, it's a very soft spot for a bacteria to travel inside your brain. So when you are having it, be careful on how you handle it, mostly when you are having high fevers. So I've said first sign for meningitis, neck stiffness. We call it knuckle rigidity. Neck stiffness, neck stiffness. Yes, Carole West is asking, Benjamin, my question is what causes the foot to be swollen? Yes, Carole West, there are so many things that makes the foot, let me answer, then I continue. The feet to swell. When most women, when they are pregnant, the left foot swells a lot. Why? Because of one thing. From up to down, we have veins and nerves. When you are pregnant, some veins called iliac veins, they lie. They are pressed by the baby. So the return of blood becomes a problem. You get it? When the return of blood becomes a problem, it piles down. It piles down your legs. So when it piles down your legs, what happens? Blood is made of cells, water, which is serum, and some other things like platelets. So the water part, which is serum, sits outside the feet, eh, to the muscles. When you press it, it goes inside. We call it pitting edema. Edema cannot be brought by that only. High BPs, high cholesterol, constriction of your arteries. When you have taken a lot of cholesterols and they are piling in your system, the blood becomes thick and it may pile in the tubes of your arteries. So let me draw something here. So you find that the blood passing is a problem. Yeah, like you see, let's say what I've drawn here. What I have drawn here, this is a vein. Then whatever I have done here is a pile of some cholesterol. So there is a narrow passage. So what happens if it is under the feet? Hmm? Most most feet swell because your leg, like this, let me swell. Your leg is having some diversion down here. So the area of diversion, this is yeah, let me put it well so you can see. Yes, like that. Your leg is like that. So the area of diversion of your veins is where the constriction is. So blood piles this side, and then it starts to sip water outside the arteries and veins, and then the muscles swell. That one is one reason, because of pile up of cholesterol in your arteries and veins. The other one is because a pregnant woman, the baby has pressed some veins and nerves. The other one is called atherosclerosis. Sclerosis means tough, tough veins that have constricted, tough veins that have constricted. They are not passing blood as it needs. They are just filling blood. So your leg becomes edematous. And you know, your muscles of your legs, your calf muscles, your muscles of your legs down there, they help you pump blood. So those are few ways in which your legs can can be swollen. When you are traveling for so long and then you are seated, what will happen? Blood return up to the heart becomes so slow. It is not good to sit for so long when you have this problem. You if you're traveling long, travel some distance, stop, walk like that. Or you're in a bus, sit down, stand, walk a bit, sit down, so that it may regulate. Unless if you have Caroli, if you have a specific complaint, because there must be some other complaints that will lead me to tell you this is your problem. One, a person with high cholesterol levels. Two, this is Benjamin. Is my father. He is 94, all fit, is swollen, so bad. I took him to the doctor. They did nothing but told him to elevate. Yes, when you are old at that age, what happens, Caroli? In your blood vessels, there are some valves. There are some valves that helps your blood not to come back. You get it? Not to return back. But at old age, most of these valves are not doing their job well, or your heart pumping capacity has reduced. So at this age, instead of doing more surgeries or doing giving more medicine, we advise the patient to elevate at home and give some drugs to make them at least better. But we may discuss this one. There is a video that is coming that we are discussing heart conditions in details. In details, that will be a good thing. If your father has been hypertensive for long, it may be a cause. If your father has or your relative has rheumatic heart disease, which affects the valves of the heart, that may be the cause. If you have another thing called deep venous thrombosis due to cholesterol, it may be the cause. If you have atherosclerosis or arteriosclerosis, whereby your veins are thickening, it may be the cause, because thickening comes with constriction. When that video will come, we will really learn, and we will know how to manage them. But for now, I would advise for a 94-year-old, use a bit of diuretics, which are potassium sparing, like spironolactone. Spironolactone. Don't use furosemide. Furosemide is not potassium sparing, and furosemide, and it takes away potassium. At that age, the patient needs potassium for the heart. So what do we do? You use spironolactone as a diuretic to remove excess water and balance the BP. Very well. Let's ask questions that we continue. Now, we were at brain death and disability of movement. Now, there are some cases like I can forget this. We were talking about what can make you be confused and do what and not function well when you are sick. You become delusional, you forget things. Malaria in tropical African countries. In Africa here, malaria is a disease that disturbs so many people. A female mosquito bites. Don't worry about that. I will discuss that more, and I would advise you email me. Let me put that your email. My email. My email is there. You email me, I'll respond, and I'll give you ways to deal with even the dementia. But remember, we are at our topic next week. We are dealing with mental health. I'll train people how to improve people with dementia. It is coming this week. Very well, very well, very well. Let's continue. I was explaining about malaria and how it can lead to brain death and difficulty in functioning well. Now, how do malaria be, do a person of malaria become mentally unstable? How? Like this. A female mosquito bites a person who has the sporozoid. Sporozoids are eggs of malaria. It carries them to a person who is clean, and then they travel, they multiply, they go to the liver. Now, in the liver, they are forming some colonies. That's why people with malaria, you will see their eyes yellow. Then those malaria parasites destroys liver cells. When they destroy liver cells, Benjamin want to make affluent of the topic. Oh, okay. We are talking about how a disease makes a person forgetful, get disabilities, get confusion. When a person is just sick and you all of a sudden start finding a person, he's delusional or he has changed, is like a mad person. And we have said how the brain works. Now we are talking about how diseases can make you, how some things like toxins get to your disease, to your brain, and then when they get to your brain, they make your brain function the other way. So we have talked about, for those who are coming to the platform, causes of encephalopathy. Encephalopathy, we have said, is any disease that alters the brain function, leads to mental status confusion, memory problems, personality changes, and unconsciousness. And we have gone through hepatic encephalopathy, yes, toxins that are brought by the liver. Two, we have talked about hypoxic ischemia, which is ischemia. Ischemia is lack of oxygen. Yes, or lack of the oxygen of the brain. We have talked about metabolic encephalopathy when it comes to your kidney, how your kidney can make your brain not to function well. You see, hypoglycemia, your kidney balances sugar levels and even insulin from your isolates of Langerhans and vitamin B deficiency. Now, we were at toxic encephalopathy. That is the fourth. How drugs and alcohol. Next topic, it will be about drugs and alcohol. We will see how alcohol can kill your brain. Alcohol is not good to be taken excessively. That's why people, when they take alcohol, they go unconscious and dehydrated. We will see how, what happens to the liver that makes a person dehydrated and unconscious. Yes. We go to infectious encephalopathy. We were there. That's why where I was talking about malaria. Now I was at the liver. When the liver cells, the parasites have killed the liver cells, what happens? They they go from it, travels to the bloodstream, it travels to the bloodstream, it goes up to your brain. Bilirubin. I started discussing what bilirubin is. Bilirubin is a byproduct of a dead cell, of a red blood cell. You get it? This is, let's not laugh about medical conditions because we all have our problems. I think it's Lady M was just saying hi, Carol Lewis. Don't worry about that. I usually say let's love everyone. Good vibes, good vibes. Let's not take mistakenly what someone else does. If you have a question that has been burning you medically, post it. If it is private, my email is there. You send a private email, I will reply. It is very confidential, and I'm a licensed doctor. We will be very confidential. Yes, yes, yes. Now, when the bilirubin, your red blood cell dies, it produces bilirubin and what? And a protein, amino. So what does, where do bilirubin goes? This bilirubin is supposed to be converted into water, soluble, so that you can urinate or go to the loo. But your liver is not working well, and the malaria parasites are killing the liver. So what does it do? The bilirubin comes out that is not conjugated. It cannot be water soluble, so it goes to your brain. Going to your brain, it makes you start being like a mad person. Why? Because one, it is interfering with the basal ganglia, a place that helps you on movement, a place that helps you on how to coordinate. If I ask you, hi, how is you? You remember, oh, this is Dr. Benjamin is saying hi. But if that place, bilirubin has filled it up, you will not remember this is even Dr. Benjamin. No, you will not. You will look at me like, who is this saying hi? Because you are sick. So those are the things that we should be careful about. You see, hypertensive encephalopathy, when your BPs are so high, and remember when your BPs are so high, what can you get? You can get stroke. Why? Because part of your brain can rupture. Your brain has vessels that supply oxygen in it. Just as the blood, it supplies oxygen and the nutrients because it regenerates. So when they burst because of high pressure, you see, you become confused and go to a coma. Chronic traumatic encephalopathy, repeated head injury. You always see those boxers because of punches of the brain, pa, 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 pa. The brain becomes injured because it is receiving pressure all the time, and it may get to inside of the brain where we have basal ganglia, and you may die. After stroke, it's death because reviving a brain is a complicated thing. We talked about, went on an overview of high glucose levels and how they cause people to go unconscious. If you have a family member who has, we said when it comes to diabetes, there are two types of diabetes, type 1 and type 2. We will see others like mellitus and insipidus. But high glucose levels, if you are born with it, you have to take insulin. But if you are not born with it, look at lifestyle or other disease that may have brought the disease. You get it? Look at it very well so that you may not end up with complications, because uh, when it comes to complications of diabetes, one, you may get a diabetic foot ulcer. A diabetic foot ulcer, if you have one of the members of family or a friend who you know is having a wound that is not healing and this person is diabetic, just know the sugar levels are not controlled. Why? Because when your sugar levels are so high, you become a host of every bacteria. You have a wound. The bacteria will want to come to the wound to get the sugar that you have. So the wound will not heal. Wounds heal if there is no presence of bacteria. And that's why some wounds that are chronic, we take honey, the normal bee honey from bees. We take it and paste there so that some bacteria, honey is not a drug. If you have ever seen a person using honey to heal a wound, it's not a drug. This is what happens. Instead of bacteria eating your flesh or your tissues, they become confused and they start eating the honey. So in that, what do we do? Your flesh where the wound is starts to heal. But in diabetes, the key thing that you should check is reduced sugar level. If someone has, that is a complication of diabetes. If someone has diabetes, make sure sugars are controlled. The wound will heal faster. Give antibiotics as a prophylaxis, even if this person is not sick, it's just an ulcer. Because if you leave him without antibiotics, more and bacteria will come in and the wound will go big. The other complication of diabetes is acidosis, mostly ketoacidosis. Your kidney may be affected because now there is a lot of sugar levels in your system. The kidney is overwhelmed, even balancing sodium and everything that is supposed to be filtered becomes a problem. So you go to a state called acidosis, more pileup of acids in your body. You get it? And you know, when your brain gets a lot of glucose again, a problem. You get encephalopathy. Yes. Thank you so much. We are going continuing. You get it? You get it? We are continuing. How a disease can make you become confused. If you've ever had a relative, a friend, or someone who got pneumonia or who had a cough and you thought it was just a chest problem, this person ended up in a health facility, but after some time you were told the guy has gone nuts. You see, this guy is not nuts. That guy did not go nuts. It's because they did not control some aspects in that person as time that was needed. You get it? We have talked of infections. Infections, we have talked of meningitis. We have talked of trauma, people that get brain injuries, our children that ride like riders, like riding bikes without helmets. They hit their head, they stand today, they are okay. Tomorrow they ride recklessly, they fall down, they hit their head down. That may bring head injury. Head injury is a wide topic. We will see how head injury leads to many things, even regulations of some movements. Some movements. It reminds me about I had talked about cranial nerves, nerves that help you see, talk, taste. They help you feel touch. They help you do many things. There are 12. They originate from the brain. We will start by optic. Optic is nerve helps you see with the help of occipital lobe of the brain. Optic, ophthalmic. Yes, you see, ophthalmic nerve. What does it do? And then we have optic, ophthalmic, oculomotor. Yes, oculomotor. We have 12. Let me open them up so that we can learn, so that you know what helps you do what. If you are not sensing somewhere in your face, just know facial nerve is not working. These are the nerves that helps us uh, be know what to do, coordinate. Yes, they are called cranial nerves. From the brain. You know, the brain is everything. We said the central processing unit of a human being, like a computer which has a CPU. Now, your brain is your CPU. Your brain is your CPU. And that's why I'm moving very slow to this topic, so that when we will come in future, if someone asks something, I'll just be referring to video number flan, the number what, so that you can be going through it at your own pace. Now, the cranial nerves, we have seen olfactory. We start by one. Olfactory. What is olfactory nerve? It arises from the brain. When you are sensing that is sweet, delicious, just know olfactory is working. Olfactory nerve. The nerve picks the sense. It hits your basal ganglia, it hits your brain, and then you feel it's delicious. Sense of smell, olfactory. Optic, sense of vision. Optic, optician, optic. It's called the optic nerve. It helps you see far things, color, perception. You see shapes. It's called optic, number two. Number three, oculomotor. Oculomotor, motor, muscles, oculomotor, muscles. That is cranial number three. What does oculomotor do? Eye movement. Eye. When you want to turn your eyes this side, the cranial nerves helps you to turn. Now, Dr. Ben, look at that thing. I turn your eye. Instead of turning my neck, I just turn my eyes. I've seen it. Oculomotor. And pupils. When have you ever seen a cat? Yes, Marcia, welcome to the platform. A cat can put it eyes wide or the black thing. Yes, for those who, yes, you see, now the pupils, it is the oculomotor which can make you do that. You get it? Oculomotor nerve. We are on the cranial nerve. Now that is cranial nerve number 3. Then we have the fourth cranial nerve, the fourth trochlear, eye movement, oblique, when you want to look up like this without turning your head. It is the nerve which makes your eyes move up. Trigemina. Now, trigemina is a very funny nerve from your head. Trigemina. It has both facial sensation when person touches like this, and then you wake up. You wake up. Trigeminal helps to tell you that yeah someone is touching you. Someone is touching you. And then chewing. It's a nerve which coordinates the chewing. So when a person is sick and you see she has a problem in chewing food, just know this person has a problem with that nerve. Up to sense, eye movement, facial nerve, facial helps here. Vestibulocochlear, those are cranial nerves, up to 12. Vagus, accessory, hypoglossal, glossal is for tongue. They help you. Now we know we a bit know how when a person is sick and then this person is not coordinating to everything, is not coordinating. You are talking to this person and this person is looking like you to you like this. You get it? Yes, guys, welcome Evelyn. Evelyn, welcome to the platform. Marcia, my friend. Beauty, I can see you. Caroli West. Yeah, you're still here. Very nice, very nice. I think even if I'm using some medical terms, one or two things is coming up and you're getting help. If you have a question that we can raise, I see time is going, please just ask that question so that we can help someone. You get it? So that we can help someone to do what? To stay like yeah, dementia. And Carol, I would very much love you to go back to the video of the human brain. Go listen to me very slowly about that. You will understand. But the other part of dementia, please email me. I'll help you so much. And I'm bringing a video where we will talk about dementia only. Dementia. Our ladies have a very nice, able ladies. I know those that had that problem of menses and other things, you were really helped by my video about the menstrual cycles, painful cramping, and so. Now we know if you have a lady who is on menses and this person is feeling so much pain, you get it? And this person is moody, what do we do? You know what to do. Most of menstrual issues in women, they are brought by what? Hormonal imbalance. Even the bleeding, if you are bleeding so much, hormonal imbalance. And now we know painkillers only cannot treat too much bleeding and pain. So what happens? You can take, we learned about how neurotransmitter like serotonin, dopamine, and adrenaline, norepinephrine, they help you in menses not to have pain and mood swings. So when a person is having mood swings and in menses, what do we know? We know serotonin is down. So what do? We buy a drug that will bring serotonin up. Like which one? One that will block an enzyme that is breaking down serotonin. These drugs are antidepressants like fluoxetine. Yes, thank you very much for being in the platform today. It was just a quick pass on to talk about some issues. And tomorrow we are having, please, if you have someone who is under substance abuse, and so tomorrow will be a good day. I had put the video at 12. I think I'll put it at a good time where many people will have a chance to discuss and know how to I'm coming, yes. And know how to deal with addiction of drugs, substance abuse, so that we cannot go into depression. These drugs, we have a way to get out of addictions medically. Very simple way. Thank you so much, my viewers, my friends, Marcia, Carole, everyone who has been on the platform. Let's meet tomorrow when we are helping people that are addicted to substance and it's leading them to depression. Good. Be blessed. You are welcome. Today's session has ended. Let's meet tomorrow and say hi to every lovely member. Remember, love is my religion. Let's love everyone. Good day.